Though he retired more than a decade ago after 31 years at the San Bernardino Police Department, Steve Filson seems anything but retired. He now spends his days as the Director of Security and Cadet Services at the Public Safety Academy, a program based in San Bernardino that focuses on training future public safety officers. Upon first meeting Filson outside his office building, minutes before our interview with him, Filson made sure to inspect a line of his cadets from a distance, making certain that everyone was in order, like a man who had lived a life with attention to detail. Filson may spend his days as Director of Security, but it's his nights that he spends with arguably an even deeper passion. Filson is also the Secretary-Treasurer for Victims of Illicit Drugs, or VOID. It's a nonprofit organization that spreads awareness and education about fentanyl in an attempt to reduce the number of deaths from this illegal substance.
We're out there doing presentations at schools, primarily in the Orange County, Riverside areas at this particular time. Our Vice President, Amy Neville, with VOID, she also has another foundation, the Alexander Neville Foundation, which was named in honor of her son, who was 15 when he was killed by fentanyl toxicity. Took a counterfeit pill that he didn't know was fentanyl, but was a counterfeit Oxycontin, and she found him dead. Amy has been an integral part of, spreading the word throughout the educational environment in elementary, middle, and high schools in the Orange County area. Also in the state of Arizona, she has a coalition. Jaime Puerta, our president, and myself, and other members of the board, we're getting the word out, trying to make our presence known and provide presentations to anybody that'll listen. We say, give us an audience and we'll tell the story, and it's an important one. Our presentations are typically they're less than an hour. We show our documentary that we were privileged enough to ask to participate in, Dead on Arrival, and followed up by a Q&A period right after that. We showed it here at my school with both our high school and middle school population. So that's 12 to 18 years of age, and the kids were riveted. They were, a lot of them knew about fentanyl, but I don't think that they understood the complete, ramifications of it if they did use it, or the potential of them, being poisoned and killed from it.
In the empire of illicit drugs, fentanyl stands as the most deadly. It is also something that is personal as it gets for Filson. He lost his daughter, Jessica Filson, to an accidental overdose.
And people that are, purchasing cocaine to use are finding themselves dead. My daughter was one of them. She and her boyfriend were celebrating his birthday, which was going to occur a couple of days later, and they ordered some coke, ingested it, and my wife found him dead the next morning.
How important is it to kind of tell your own personal story when it comes to educating the public? I know you talked about your story on Dead on Arrival. How important do you think it is to tell your story and make it personal for people?
Well, I think the only way to personalize things is to let people know what happened to you. I'm not ashamed. I was a police officer. I retired after 30 years with San Bernardino Police, and I had a great life and great family, and everything went out good. Was this supposed to happen to me? No. But am I ashamed of it? No, I'm not ashamed of Jessica. She made a mistake, and that mistake turned out to be one that cost her life. But she's like many people in the world.
In his office, on the highest shelf, rests a photo of his granddaughter, Ilara. Before the interview, Filson picked it up, held it in his hands, and carefully showed it to us. He plans to take her to her first dance now that her mother can't. VOID consists of a group of board members who each lost someone to a fentanyl overdose, just as Filson has. Jaime Puerta lost his only son. Amy Neville lost her firstborn child. They make no attempt to hide the fact that this is personal to them. From Riverside City College Viewpoints, in partnership with California Humanities, through the Democracy and Informed Citizen Emerging Journalists Fellowship Program, I'm Will L.G. Stevens, and this is Fentanyl Empire. This is the second episode in our three-part series, A Chronic Relapsing Disease. Our body naturally produces chemicals, known as endogenous opioids, in response to pain or stress. It then attaches to opioid receptors found within the central nervous system. Fentanyl, like other opioid-related drugs, works by binding to the body's opioid receptors and provides a much stronger pain-relieving sensation. When used for short periods of time, like after a surgery or a traumatic experience, the drugs are generally safe. However, misuse of the drug can lead to a dependency or even an addiction, which Dr. Michael Levine, Associate Professor of Emergency Medicine at University of California, Los Angeles, expanded on.
Yeah, so addiction is when someone has a craving, and it could be, when you get both a psychological cravings and a physical dependence on needing a specific type of drug. And one of the things that you see with addiction is people will have, depending on what the substance is, you may or may not have physiologic effects. But with opiates, for example, you get some physiologic effects to where you start craving, and you could get some withdrawal symptoms if you no longer are getting them.
And it's this dependency the drug creates that may have contributed to Jessica Filson's untimely death, as Steve Filson explained.
She also had a substance use issue with pills. You know, she when Alara was born, she was given an epidural, which caused some chronic back pain and severe back pain, and it was treated with Oxycontin, Percocets, or whatever the heck the doctor prescribed to her. But then when that the prescriptions run out, they have to seek it somewhere else. So she had a pain pill problem that haunted her for a while, and it evolved into whatever. But the biggest issue is she used something. She knew the threat, but I don't think she thought it was ever going to happen to her. And unfortunately, that one bad decision shouldn't have cost her life, but it did because of fentanyl.
On the other side of the spectrum are Samuel Cuevas and Michael Moya, who reside in a sober living facility in Riverside called House of Courage. Both are no strangers to addiction and the hardships it creates. Sober livings like this are spread throughout the Inland Empire, many of them at full capacity. Make no mistake about it, sober living is a business just like anything else. The 20 house residents are advised to call 911 in case of an overdose. Just give them the address and say your friend isn't breathing. Don't tell them it's an overdose, and don't tell them it's a sober living. Why? Because the paramedics tend to come faster. Cuevas, who is 24 years old, is one of the youngest residents in House of Courage and has almost a year of sobriety under his belt. However, before he decided to change his life, his drug of choice was fentanyl.
At first, I didn't think I had a problem, so I was, just going on a limb and making, I thought if I worked and was able to pay my bills that it didn't matter what I did. So I got into fentanyl, and I actually got kicked out of my house, out of my mother's house, because she thought I was just taking oxy, so I immediately ran that out. One of my aunts actually heard about that, and she's like, oh, because she's just an enabler and a super helpful person. She decided, let me take him in. I went into there, was there probably about 6 months. Drug addiction got carried away, ended up getting kicked out of there. I had met this girl that I had been talking to for quite a long time. I stayed with her for about 2 years, and then over time she just grew tired of it as well. And then I ended up homeless at some point. I had no options. I had burned every bridge possible and just made it to where there was literally no help.
Then there is Michael Moya. Moya, in his Nirvana jean jacket and skinny jeans with suspender straps hanging from them, seemed comfortable talking to us, calling himself an open book. He has a bright smile and a genuine laugh, though his outlook on life seems grim. Whereas Cuevas was looking ahead to the future, Moya seemed as though he was white-knuckling each day, like he was tugging on an electric fence to see how long he could hold on. Moya was a rapid heroin user, but switched to fentanyl when he realized he could get something that was cheaper, lasted longer, and was extremely more potent than heroin. For people like Moya, who were openly admit to having an addictive personality, smoking a joint and having a beer can become a gateway into sticking a needle in their arm and pumping their bodies full of heroin. Before they know it, they are either knowingly or unknowingly using fentanyl.
At certain points, I would look for the fentanyl, like the heroin that was cut with fentanyl, because I knew it was stronger and I wanted to get the bang for my buck. But prior to that, like I stated, like I wasn't really, I was trying to stay away from fentanyl, so I was usually doing heroin, so I tried to stay away from it, but it got to the point where, my addiction was so heavy and I needed so much that it just made sense financially to, get the bang for my buck, essentially.
At the time of this interview, Moya claimed to have been about 2 months clean. Through interviewing him, we had no reason to question him, but as you will find out later, this claim was false. Almost every single individual we have interviewed for this project has some experience with fentanyl overdoses. Some were in charge of mitigating the number of fatalities, others lost a family member, or some had first-hand knowledge of an overdose. Through talking to the interviewees, one thing was made clear: overdosing is an inevitable fact when dealing with fentanyl. So it's important to answer the question, what does a fentanyl overdose look like? Again, Dr. Levine.
So you get kind of a classic combination of respiratory depression. So you stop taking in deep breaths, and you don't, and the breaths that you do take are really shallow. So you get ineffective breathing. You get coma, so CNS depression or central nervous system depression, where you become unconscious, and you get very, very small pupils, or what's called meiosis, which is a kind of a classic pattern that you could also see associated with opiates. So it's that triad of CNS depression, respiratory depression, and meiosis.
It's a state that both Moya and Cuevas can attest to, as they have seen it and experienced it.
I've overdosed maybe 3 times. And then I've had people overdose on me twice. One of them, we didn't have to Narcan. Luckily, he came to. The other one was my cousin, and I had to Narcan him twice and give him CPR and the whole nine, and he actually came back. So yeah, I mean, it kind of comes with the territory when you're, especially as an opiate addict for almost a decade. You're gonna run into it, whether you overdose or you witness it.
My first overdose was actually in my brother's bathroom. This was like, he was letting me stay there at the time because I was going to move out of state because I realized, maybe all this wasn't going to work. So I was going to go out to Arizona within 2 days. And I had to actually took a little break off of it, not necessarily completely stopped it, but just kind of minimized how much I was using. And I ended up realizing, like, damn, I only have 2 more days left. So I was like, okay, let's go ahead and try a little bit more, just like, for old time's sake, get that one last hurrah out. And I did, and I ended up waking up with completely gashed right side of my face, and with like 3 paramedics and like 4 Narcan syringes just surrounding me, and my brother just freaking out. And that's pretty much how that first experience was. And the last time was I overdosed on the freeway and crashed into a wall and then got arrested right after. So I was pretty much at the point where I decided, it's either going to be jail, death, or get myself together. There was no other options.
Now imagine this cycle on a grand scale, throughout an entire region that already has a history of drug abuse. Every day, Inland Empire residents are rolling the dice and either knowingly or unknowingly overdosing and inevitably dying. And the numbers of how many people have died due to fentanyl in the past few years is shocking, as Wendy Hetherington, who works at Riverside County's Public Health Department as the Chief of Epidemiology and Program Evaluation Branch, explained.
In 2021, as of the last report, like I said, so it takes a while to finalize death reports, like toxicology has to come in, et cetera, et cetera. So I wouldn't say until June or so is when we'll say, okay, these are close enough to being final numbers, but it always takes a while. So as of our last reports in April, we had 769 total overdose fatalities in Riverside County. What's particularly concerning for me is that we've noticed an increase in overdose fatalities among people experiencing homelessness. And those deaths have increased dramatically. So we had 64 in 2019, and now we're at 151 for 2021. So more than doubled. But in terms of fentanyl, so in 2021, so in 10 years, so like I mentioned, in 2011, we had 5 fentanyl overdoses. In 2021, 389. Methamphetamine related overdose, we had 443. So you could see there's that there's still more methamphetamine, but I will say that meth without fentanyl was 266. So that's still a fairly good number, but meth with fentanyl was 177. And in 2019, we had 39 of those. So you could see in 2020 the numbers just went up.
As of June 10th, the statistics indicate for the year 2020, Riverside County had 690 deaths from an overdose, where fentanyl accounted for 283 deaths. In 2021, Riverside County had 799 overdose deaths, and the fentanyl-related deaths grew to 402. And San Bernardino County is seeing a similar trend, according to Steve Filson.
I know in San Bernardino County, for example, in 2020, there were 298 fentanyl-related deaths. The final count, there's a few still pending toxicology for 2021. It jumped to over 400. Okay, so in 2 years, we've had over 700 deaths in the county of San Bernardino. The city of San Bernardino itself has experienced close to 60 or over 60 deaths in which fentanyl was a contributing factor in the death of the person. When I say a contributing factor, but for fentanyl, the person would still be alive. That's my daughter's case. But for fentanyl, she would still be alive.
Luckily, not everyone succumbs to the lethality of fentanyl. There is an antidote that is considered a miracle drug that can help stop and revive victims of an overdose, and it's called Narcan. Narcan, or naloxone, acts as an opioid antagonist that attaches itself to the opioid receptors, reverses and blocks the opioid effects. It can also quickly restore the breathing to normal. There are 2 ways to administer this drug. It comes as an injectable that is inserted into muscle, vein, or under the skin. However, the proper dose has to be extracted from a vial and can seem scary to use for everyday people. The drug is also prepackaged as a nasal spray that is inserted through the nostril and squeezed to release the naloxone. This method is a lot more user-friendly, and many programs hand out the drug for free, according to Wendy.
Narcan, it's very easy to administer. There's a lot of programs at the state level and through groups like IEHR to get free Narcan. Narcan should be given anytime someone's prescribed opioids. But again, our issue with overdose deaths in Riverside County, it's not really, they may have initially become addicted to prescription opioids, but most of our overdose deaths are related to illicit drug use.
The opioid antagonist can also be purchased over the counter without a prescription at the nearest pharmacy for an average of $50. However, it should be noted that administering Narcan does not remove the opioids from the person's system. It only reverses the overdose in the body for about 30 to 90 minutes. It is still possible for the person to experience the overdose again after the naloxone wears off. Other times, the opioids are so strong that multiple doses of Narcan are needed. For many, this brush with death can be the wake-up call they need to seek sobriety and overcome the grip that fentanyl has on their lives. However, the journey to sobriety is just as hard, if not harder, than the life they lived while on synthetic opioids. The fentanyl user first has to detox, which comes with painful and sometimes dangerous withdrawal symptoms. They can experience anxiety, pain, vomiting, diarrhea, muscle cramps, or a fever. Fortunately, there are detox centers where doctors provide medications to ease the detox period. Again, Dr. Levine.
And patients that have used opiates for a while, we often will start them on a medicine called buprenorphine, which is an opiate, but it's what we call a partial agonist, meaning that it binds to the opiate receptor but doesn't produce the full effect. So you get some mild opiate effect, but it has somewhat of a ceiling limit to prevent you from getting from either A, being able to use additional opiates at that time, but also prevents you from getting too sick. It's kind of hard to overdose on that drug specifically because you're not going to get a full agonist effect.
If they manage to make it past the detox period, which not all do, the recommended route is to go to rehab. Once in rehab, a counselor meets with them and makes a treatment plan. That treatment plan will dictate how long the patient stays for rehab. This generally will be anywhere between 30 to 90 days, sometimes less, sometimes longer, depending on a wide array of circumstances.
Addiction is really best treated from a two-pronged approach. So there's counseling and therapy along with medication. So it's generally referred to as medication-assisted therapy, or MAT. So that's the use of some opioid, whether it's buprenorphine or methadone, are the two big ones that are used in conjunction with counseling and therapy, and things like similar to how alcoholics go to Alcoholics Anonymous. There's Opiate Anonymous, or it's called Narcotic Anonymous, or NA, in which are helping people discuss similar cravings and discuss that come from similar or different backgrounds, but all kind of share one common problem in that they have an opioid addiction, and discuss that. So that combination of counseling, support groups in conjunction with medicine has really been shown to be the most effective, more than either just medicines or just counseling alone.
If you're on the outside looking in, you might ask yourself, what would motivate someone to take something so destructive? What would cause a person to fall into a trap of drug use when the horrors of addiction, the hardships of withdrawals, or the potential for overdoses are so widely known? In other words, what is the root cause of addiction? Well, according to Wendy Hetherington, childhood trauma, or just trauma in general, can lead to addiction.
Addiction is, as I mentioned, it's a chronic relapsing disease, and people become addicted. So you could become addicted to anything. You've heard, gambling, drugs, alcohol, whatever. But oftentimes the root cause of addiction is trauma, which is, unhealed pain, like unhealed internal pain. And oftentimes it comes from childhood, our adverse childhood experiences. You may have heard ACEs. The higher you score on this ACE test, the more likely it could lead to some either addiction or other health concerns, et cetera, et cetera.
And it kind of makes me wonder a little bit, does the Inland Empire, or does Riverside County, do we have an addiction problem, or I would say more of a trauma problem, it sounds like, because trauma leads to addiction.
Right.
Is there is that a really big problem here in Riverside County, like trauma, and which leads to addiction?
I think we do have, because I mentioned the ACEs score, so adverse childhood experiences. There's 10 questions that you ask, like, when you were a child, did you experience abuse or neglect, or parents who used drugs or were addicted to alcohol, and goes through this thing. And usually there's a dose response to that. So if you have 1 ACE, 2 ACE, 3 ACE, but when you get to 4 or more, that group of people are more likely to have some of these poor outcomes. And so Riverside County, we do have a higher rate of people who score 4 or more. But I wouldn't I wouldn't necessarily say we're more addicted than any other sort of community.
Adverse Childhood Experiences, or ACE, is a quiz that consists of 10 questions about common traumatic events that children may experience. The questions on the quiz range from topics of verbal and physical abuse to divorce and parents in prison. According to the Center for Disease Control and Prevention, ACEs are directly linked to a person's mental and physical health, as well as the potential to negatively affect job opportunities and income. The CDC also estimates a 10% reduction of ACEs could equate to an annual savings of $56 billion. Hetherington's description of root causes for addiction and of the ACE test closely resembled Moya's childhood experience. He explained that his drug use stemmed from self-esteem issues as a child and his environmental circumstances growing up.
Yeah, I mean, I guess it just comes down to like self-esteem issues, and I think that's something that like all drug addicts suffer from is self-esteem issues, like trying to fill that void in you, and you don't know what the fuck that void is or where it comes from, especially when you're a child, essentially, like when I started to use drugs. like now I could look back in hindsight and like I'm like, okay, I was probably like, mentally ill, and my father not being there and being in prison, and growing up with a single mom, and like that whole little struggle, and then my stepfather, and then all these things in my life that like kind of add up, and trauma and abuse and everything, and you look back at it and you're like, that's probably the reason why. But when you're using, no, you don't think about, why does this feel so good? You just know that it does, and that you want more of it,
And how do you feel like now in your sobriety? How do you feel? Do you feel like people look at you differently than when they did when you were using?
Oh yeah, definitely, dude. Like, not even like just figuratively, like how they look at you. Like, people aren't scowling at me, dude. You know what I mean? Like, yeah, like hell yeah, people look at me different. I could see it, I feel it. They're not wondering if I'm gonna overdose in their bathroom, or if I'm high around their kids, or it's right now it's cool to be in this position and not have people trust me to a certain extent. It feels good.
Shortly after recording this interview with Moya, we were informed he had been asked to leave House of Courage. Moya entered a detox for several days and was allowed back into the House of Courage for a second chance. We reached out to him and asked him if he was willing to still talk to us and sit down for another interview. His response, yes, like I said, I'm an open book.
Well, I guess long story short, I relapsed. To be completely honest, I was using the whole time that I was here, marijuana, that is. And I kind of knew I couldn't like get away with it for much longer than I was. I was already expecting to be asked to leave. So I guess in my my addict brain was just like, well, fuck it. If we're gonna get kicked out, let's might as well do real drugs and get kicked out rather than just for marijuana. That might be like an unpopular opinion as far as marijuana and sobriety goes, but yeah, I just kind of got a case of the fuck it's, and I went out and used heroin, and I regretted it immediately. But also, like I said, the addict part of my brain was like, let's see if I could get away with it, and push this as far as it can go till the wheels fall off.
I want to look forward into the future. Where do you go from here? Or what's the next step? What's the next plan?
I don't know. I'm not trying to think too much into the future. It sounds corny and cliche, but take it day by day. I got some stuff I was thinking about as far as like where I want to move and where I want to start my life. But I think for right now, I'm gonna try not to think about those things, and just take it step by step, man. Because I kind of overwhelm myself sometimes when I think about what I want to do and what I should and have to do. So I'm just trying to take care of what I can right now, and as long as I'm sober, dude, like all the pieces are gonna fall into place. That's truly what I believe. If I'm sober, everything's just gonna work out because it has to. I'm not. I feel like I can attract that in my life. I feel like I can. Yeah, I just feel like I can attract those things in my life, and I don't have to be so hung up on the future like I used to be.
Within a little over a month, Moya was once again asked to leave House of Courage. This time, he declined to talk with us. Sometimes it isn't easy for everyone to see the human side of those addicted to drugs. However, the community must recognize that there's an addiction problem and start working toward a solution before this new epidemic gets out of control. In our next episode of Fentanyl Empire, you will hear from those who hold some of the power to change the course of this epidemic. Many of them are divided between forcing stricter laws or offering more resources for harm reduction.
The last thing is that we took a very hard line, and we have begun to investigate and prosecute cases where a drug dealer furnished or sold someone fentanyl and they died. We're prosecuting some of those cases for murder.
That's next time on Fentanyl Empire, the Inland Empire's latest drug crisis. Fentanyl Empire is produced by Daniel Hernandez, Will L.G. Stevens, Jennifer Vasquez, and Tim Nacy. This episode was written by Daniel Hernandez and Will L.G. Stevens. It was narrated by Will L.G. Stevens and edited by Daniel Hernandez. If you or anyone you know is suffering from any kind of substance use disorder or mental health crisis, you can find some resources in the description and on our website, viewpointsonline.org.